exactly is PCOS and how do you know if you have it?
So PCOS is polycystic ovarian syndrome. And the thing is that it's most common in the age group of 15 to 44, 45. And the thing is what it means, and that's why I got coined the name of it, is because of the fact that with the cystic ovaries, and usually we tend to ovulate as women, and that's how we have our menstrual cycle. What ends up happening is you develop these cysts, which have follicles, but they're immature follicles that never develop into a mature follicle, which is why you don't actually then ovulate. And when you don't ovulate, you don't have your cycle. So some of the symptoms of PCOS is skipping your cycle, not having regular menstrual periods. You sometimes tend to also have facial hair or body hair that's more than usual. The reason being too is because your hormone levels are in imbalance. So to define it really, an imbalance of hormones, you have an abundance of androgens, which is going to be your male hormones more than your female hormones. This is the reason that it throws an imbalance. Now, one of the things too is that you can have sometimes weight gain, you can have acne, you can have cystic acne, you can have the facial hair, you can have irregular menstrual cycles. It also sometimes some people will see fluctuations in their weight gain because of insulin resistance. So that kind of goes with the whole conundrum or syndrome of PCOS.
So we're starting to see more and more women, I mean, in our community here in Mississippi, talking about the issues that they have with this. When is it time to talk to a doctor, or what are the next steps?
So usually what I recommend to everyone, and a lot of times it does go undiagnosed. Actually, there is a statistic that says about 70% of women go undiagnosed, unfortunately, just because of the fact that they may have a symptom of acne, but they think it's regular acne, adult acne, teenage acne, college acne, whatever you want to call it. A lot of times, like when my patients come to me and I start seeing that they're having acne, especially in the lower part of their face, or facial hair growth, regardless of their age, in that age group of 15 to 44, that's not typical. I usually then ask them, are their cycles regular? Are they having a regular menstrual period? How long ago was the last one? Because if they start skipping regularly, and not get a cycle for every 3-6 months, you definitely need to get a workup. You need to check your actual hormones. You need to see your gynecologist or a specialist, because they need to also test your thyroid. They need to check your insulin levels, because a lot of times what we're seeing too is that they can get something called like metabolic syndrome, which is pre-diabetes, or their insulin levels are off and their blood sugars are high, and then they're storing all the fat, and that's why they're gaining weight. And they don't understand that, oh my God, what's going on with my body? I'm too young for this. And this is where it sometimes gets overlooked, and you have to take a look at the whole picture.
All right, so are there treatment options available? Is it something you can treat over the counter? What do we do next?
So I tell people never try to treat yourself, no DIYs, because at the end of the day, we need to look at a hormone panel. We need to look at a full chemistry panel. We need to look at all the labs, and then we need to decide and see, are you high on the androgen, which is the male hormone? Are you low on the female hormones? At that point too, sometimes what we will prescribe is birth control pills to help regulate the cycle and help balance those hormones. If it comes to as far as facial hair, body hair that's excess, you can have that either waxed, you can have laser hair removal, so that's not an issue. When it comes to acne, I always say then we need to address the underlying condition, because we can treat acne topically, of course, as you know, especially with adolescent acne and so forth. But what you don't want them to do is have those cystic acne. You don't want them having scarring. When it comes to also insulin resistance, there's something that we sometimes will prescribe, which is metformin, to help balance out the insulin. One of my biggest focuses, though, I always tell people, is diet, exercise, proper nutrition to help balance out your skin microbiome, gut microbiome, health for your skin. It also helps balance your blood sugar. It also helps balance some of your hormones as well, because our hormones are connected to, our fat intake, greasy foods, not greasy foods. Same thing with your acne, with your skin. So proper health, diet, nutrition, exercise, and sleep and stress. Those are things that can actually make some conditions worse.
So before it's too late, you need to start checking in. What's my stress level? What have I been eating before I go panic and call you, pretty much?
Yes. I mean, they always tell everyone, get the advice of a professional. Go get a consultation. Go ask questions. Explain what's going on. Maybe it might be nothing, but if it is something, you want to treat it sooner rather than later.
Any website you want me to send folks to get more information about all of this?
So my website is Azza, A-Z-Z-A-M-D, Beauty, B-E-A-U-T-Y, and .com. So it's azzamdbeauty.com.